Hello everyone, and welcome back to my channel. My name is Dr. Stephen Roth, and I'm a board-certified oral and maxillofacial pathologist. It's April, which means it is officially once again Oral Cancer Awareness Month. In today's video, I wanted to give you 5 tips that you can take to prevent oral cancer. First, we have to get into that disclaimer, and that is that all opinions expressed in this video are mine and mine alone, and do not represent any organization that may employ me or that I may belong to, and that this video is for educational purposes only and should not serve as medical advice. Should you have any questions or concerns about your oral or systemic health, please see your nearest oral or systemic healthcare provider. All right, so these tips are in no particular order, and there certainly are many other tips to help prevent all types of cancers, but I figured I'd start with these 5. Tip number 1, see your dentist regularly. While your dentist may not be able to prevent you from having cancer, they can catch it early. The earlier oral cancer is discovered, the better the outcome for the patient. You should be seeing your dentist at least every 6 months, and they should be performing a comprehensive soft tissue head and neck exam at least once a year, if not at every appointment. This should involve feeling your neck, as well as checking the sides of your tongue, your lips, and your cheeks. Your dentist doesn't need a special light or gadget to perform a proper head and neck cancer screening, just their hands, their eyes, and maybe a piece of gauze. You should be asking for a head and neck exam at least yearly, and if your dentist or dental hygienist doesn't do a head and neck exam at least once a year, you should probably find a new provider. Tip number 2, get vaccinated. We're used to hearing about vaccines in the context of viral infections like the flu shot or the COVID vaccine, but there's actually a vaccine against a cancer-causing virus. The human papillomavirus, or HPV, is a direct link to anal, vaginal, cervical, nasopharyngeal, and oropharyngeal cancers. In fact, HPV is found in approximately 70 to 80% of oropharyngeal cancers. Here's the key. These cancers are of the oropharynx, not the oral cavity. The oropharynx includes the tonsils and the very back of the tongue. In the front of the oropharynx, or the oral cavity, HPV is only found in 3 to 5% of cancers and doesn't change the outcome or treatment plan. As of 2023, at the time of filming this video, the CDC recommends vaccination at 11 or 12 years old. And because these vaccines and recommendations are relatively new, the CDC recommends vaccinating through the age of 26. While it is probable that a person has been exposed after the age of 26, certain patients between the ages of 26 and 45 may benefit depending on the circumstances. The current vaccine is a nonavalent vaccine, meaning it covers 9 different strains of the virus. Some of these strains are low risk, which lead to things like papillomas and warts, and some are high risk, which can lead to these cancers. While these vaccines are relatively new, the National Cancer Institute has already found an 88% lower rate of HPV infections in those that have received at least 1 dose of the vaccine. While it is true that these vaccines likely won't prevent oral cancers, they will have a lasting effect on a person's risk for oropharyngeal cancers, which is why I recommend everyone speak with their healthcare provider about either vaccinating their children or if vaccination is appropriate for them. Tip number 3, wear sunscreen. Again, not necessarily a tip for oral-specific cancer, but it is important to discuss in cancer prevention, especially due to skin cancer's prevalence in the head and neck. Skin cancers are the most common cancers to occur in the United States, and 1 in 5 people will experience at least 1 skin cancer in their lifetime. One institutional study that looked at 387 skin cancers found that 90% of them occurred on the face and scalp. The best way to prevent skin cancer? Wear wide-brimmed hats and apply sunscreen 30 minutes before heading out into the sun, and be sure to reapply throughout your exposure. One area that often gets overlooked when we think about sunscreen is the lips. I see a lot of patients with evidence of sun damage of the lips. The earliest sign of sun damage is a blended lower lip. Rather than having a sharp demarcation of where the lip starts and the skin ends, a patient may have a more blended border. Next, a patient can develop a leukoplakia or white patch on the external lip due to sun damage. We call this actinic cheilosis. The lower lip is at greater risk. Finally, a cancer can occur as a crusted ulcer of the lower lip. How can this be prevented? When you apply your sunscreen, you should also apply an SPF-embedded lip balm. While it isn't in the oral cavity, it is awfully close and a good reminder heading into the summer months here in the US. This is the SPF lip balm that I use. Tip number 4, quit smoking. This one may seem obvious, but it certainly isn't easy. Smoking is truly addictive, and it can be very hard to break the habit once you start. The good news is that even in the past few decades, smoking has, for the most part, continued to decline. Smoking is one of the most impactful risk factors for oral cancer, and 75% of oral cancers occur in former or current smokers. The risk of developing oral cancer is approximately 3 times more for a smoker than a non-smoker. Good news, 10 years after successfully quitting smoking, the risk of oral cancer is the same as someone who has never smoked. If you currently smoke and would like to learn more about quitting, I recommend calling 1-800-QUIT-NOW as a good starting place. It also may be wise to speak to your primary care provider about medical options or a referral to a smoking cessation expert. Tip number 5, drop the Paan. In many parts of the world, especially South and Southeast Asia, betel quid or Paan is chewed. This product is a combination of areca nut, slaked lime with or without tobacco, wrapped in a betel leaf. There are many different recipes and not all of them are carcinogenic. The carcinogenic or cancer-causing components are likely the areca nut and the tobacco. While this may seem remote and unfamiliar to many Americans, this product is extremely popular throughout the world and has over 600 million active regular users. There are other side effects of this product, including submucous fibrosis or scarring of the oral mucosa and significant teeth wear and staining, but the most significant is the development of precancerous and cancerous lesions. Oral cancers occur in approximately 8% of betel quid users in Asia throughout their lifetime. You may have seen the fire Paan trend from a few years ago. If you plan to partake, my recommendation would be to make sure the formulation doesn't include tobacco or areca nut. There you have it. Those are 5 tips to prevent oral cancer, or cancer in general. There are certainly a lot of other good tips out there, and these are just a few that I chose to highlight. Be sure to check out all of my other oral cancer awareness videos, conveniently packaged in a playlist available on my page. And while you're there, be sure to hit the subscribe button. Thanks again for watching, and be well.